kind of winter and winter pressures looming, and also that constant risk of another outbreak as well. So we're looking at things from a very different perspective now. So I'm going to use my presentation to feed back some of the findings from the survey that you all participated in back in June, and then we're going to hear a more local perspective from Sylvia and her team in Edinburgh, and get their reflections as well. I don't think we'll have too much time for question and answer, but we'll hopefully get a little bit of time towards the end. Just the usual housekeeping. If you're not talking, probably best to put your microphone on mute, and please do use the chat box. Lots of comments would be great, and questions, and if we don't get round to answering them today, then we'll make sure we get back to you with answers where there's questions. So please use that to its full advantage there as well. So I'm just going to get started with my presentation. Wanted to start by saying a huge thank you to all of you who participated in the survey. That was actually either the online survey or agreed to have a conversation with us, a call with us, and we got your views like that. So thank you so much. We had 28 of the 31 partnerships participate, so that's a great result. So thank you everybody for that. Just putting up a slide to start with, a quote to start with from Falkirk. I don't know if we've got anybody from Falkirk who's joined. I'm not able to see in this mode who we've got there. But this is a quote. It is anticipated that there will be some major changes in service delivery following this experience. And I suppose that was back in June, so almost 2 months later. My first question to you would be, was that your feeling at the time in June, and is that what you're now experiencing? It'd be really good to hear what your thoughts on that are. A little bit about the survey. As I say, it came out in June, and what we were asking about was the measures that you've put in place to enable service continuity during COVID, but also to support your clients and your staff during the outbreak as well. As I say, we had 28 responses. The full report will follow in the next couple of weeks. I'll just be touching on the surface today. Just to acknowledge there are limitations to the survey. When we put this out, we were aware it was a busy time for you. We didn't want it to be too onerous, so we tried to make it as easy as possible, though maybe it didn't feel like that at the time. So we didn't ask for lots of data. That would be useful, still be useful now. So that's worth considering. We also didn't ask about the impact that these responses that you've made have, what the impact has been. Again, the timing wasn't right for that, but it'd be useful to know now. And the survey didn't get a lot of detail in the responses because that's not what we were looking for. We're wanting an overview, but it gives us lots of things that we can potentially follow up on. Just wanted to give a bit of context for the survey. A few things to consider here. First of all, demand and services. I think we were all anticipating this surge in referrals and increase in activations and increase in responses, because I think we thought Telecare services had a lot to offer during lockdown. But on the whole, this didn't materialise. There were a few exceptions, one of which were Edinburgh City, so it'll be great to hear from them to hear what their experience was. Although this is also an area we don't have a lot of data on, so I might be missing out on some services who also had an increase in referrals, so please let us know in the chat box. I think it'd be useful for future planning to understand why we didn't have that surge. There's lots of theories and suggestions why that might be, but if there's anything you can suggest, add in there. But we're also planning to work with Strathclyde University to do a bit of research to better understand why that happened. It turned out that one of the biggest challenges for most, but not all, was staffing levels. Staffing levels were affected by people who were shielding, self-isolating. There was obviously some sickness. There were childcare issues, and actually bereavement turned out to be a factor as well. And what we found, this reduced demand that most experienced meant that it was actually we could get by on the staffing that was there, but there was certainly issues in some areas there too. And the TSA in their report, I don't know if you've read this, I put it up there because it's a really interesting read. They described a 35% reduction in staffing amongst their members. So that's a lot of staff not to be providing the service. And then there's the fact that we're supporting a vulnerable population, and very quickly realised that there was certainly additional things we could offer for Telecare service users, and rapidly move to ways to support these people. And then finally, really important to acknowledge that very quickly people had to adapt to new ways of working, whether it was remote working, whether it was being exposed to new and different risk on a daily basis, whether it was having to deal with PPE and other infection control measures, which in itself was a challenge, but it's also everybody was coping with this on a personal level as well. So there was a lot going on while all this service change was happening as well. So as I say, we know there was a lot of change going on. The survey confirmed that, but I think at this stage we're shifting from just finding out what you're doing to thinking and reflecting on what you're doing and asking these 4 important questions. Of all these changes that have been put in place, which are the ones that will remain relevant in the recovery phase, but also beyond that, and need to be sustained and built on? What are the ones that we actually want to stop doing or phase out, either because they're no longer useful or desirable, or there's actually some risk associated if they're carried on in the longer term? What parts of the service have been put on hold that need to be reactivated? And of course, associated with that is the backlog that might have built up while things haven't been working as usual. And then finally, what are the lessons we can learn that can strengthen our service continuity plans if there are further outbreaks or for other crises as well? So that's the focus, that's what we're thinking while I'm going through the findings here. And we asked about 8 areas of Telecare, and I'm briefly going to go through them all. As I say, it's just a high level feedback, and details are to follow in the report. So starting off with referrals, assessment and equipment, 70% of services said they were doing things differently in this area. So that's 19 services who introduced changes, but there were 8 who didn't, and we'll come back to that. So those who did introduce changes, 14 described introducing some kind of priority system to process their referrals. This might be red, amber and green triage. People talked about priority 1, 2, 3. A lot of things were mentioned, not a lot of detail, but that's something we could find out more about. But it tended to be the areas where people were prioritising were referrals to support hospital discharge, to prevent hospital admission, and for palliative and end-of-life care. 5 services described putting non-critical and urgent referrals and non-urgent referrals on hold. 3 described deliberately reducing the number of complex installations, partly because of the contact required for that and the maintenance that might be required. But 2 actually described increasing complex installations, so a bit of variation there. And what we found from the survey was that where that demand didn't increase, services quite quickly stepped down these changes, and referrals started to come in again there. I think important to note, though, that for many this will have created a backlog. So now it's about managing that backlog as well as getting referrals up and running. And then again, and I just mentioned a comment from North Lanarkshire there. They anticipated this backlog, and what they were doing, they continued to approve their lower priority referrals, record their assessments on the ARC system, but they didn't allocate an alarm. And if there's anybody from North Lanarkshire there, if there's anything we can put in the chat box about that, we'd be interested to hear it. In terms of those services, I thought somebody was coming in there. In terms of the areas that didn't introduce changes, East Ayrshire continued to encourage their assessors to think tech. Some areas did notice there was an increase in referrals to prevent care home admission, and as West Dunn said there, in their area and many areas there was no care home admissions going on because of the COVID challenges relating to care homes. So that did result in an increase in referrals, but also an increase in the types of equipment being installed. Suspension of daycare and respite also caused increase in referrals, and 2 services described increased complex installation, probably for those reasons as well. So this is all good learning for future service continuity plans and areas it's worth considering. couple of other things just to feed back on. South Lanarkshire, they increased the number of GSM-based units they were installing because people were unable to get landlines installed, so another useful thing for future plans. And East Ayrshire described their team providing and setting up tech that connects to carers' pagers rather than the alarm receiving centre and the response service, which also obviously limits contact with services and people who are vulnerable, but also takes a bit of pressure off the service, the alarm receiving service too. So just a flavour of that. So you'll all be interpreting that in your own way locally, you'll have your own perspectives, but nationally there's a few things I just wanted to think about for us. The TSA's paper that I mentioned before, they highlighted that many services had shifted to easy to deploy, low contact, self-installed technologies. We didn't hear an awful lot about that, but really be interested to hear if there's any more you want to share with us about that. We will follow up with East Ayrshire to hear more about what they were doing, and also link in with our colleagues down south to hear the practicalities, benefits and risks of deploying less traditional technology and what we can learn from that. Just wanted to mention as well that Glasgow City developed a website, and they've talked about this in previous drop-in sessions, for families and clients so they could consider citizen technology, getting their own technology, and they also produced a guide to keeping connected as well, which is still available, and maybe if anybody's able to put the link in the box so we could share it later, just to remind people about that. Second area, installations and withdrawals. 92% said they were doing things differently. A lot of common ground here. 13 partnerships talking about pre-visit protocols being introduced, whether it's screening questions, routine checks about shielding, additional calls on the day of visit, use of PPE. A number of services talked about PPE and social distancing. Nobody reported any issues getting PPE, so we didn't pick up on that. But again, please use the chat box if this was something that you experienced. And also people sharing decontamination and recycling processes as well. So things that we can learn for the future. Three services talked about how they streamlined their installation approach. So they wanted to reduce the number of people involved and also the number of visits required as well, again for infection control. And three services described getting others involved in installation, redeploying Telecare staff. And because a lot of responder staff would usually be involved in installation, a number of them just focused on responding, and others took on the installation work. And Clacks and Stirling reported working with their housing team for more complex installations, and are planning to do further work on that as well. Lots to learn that might be sustained and built on. We've heard previously from East Lothian, Mary and Alison, about what they've been doing with remote working for installers. 13 partnerships introduced self-installation protocols, which is a shift in practice. So that's quite an impressive change in a short time. So we'll come back to that. And Clacks and Stirling described dropping off units in hospital pre-discharge so people could take their units home and self-install as well. East Ayrshire have developed video tutorials on programming and installing digital units. They've deployed a number of digital units now, so hopefully lots of learning there too. And South Lanarkshire have described using Near Me to support GPS locator installation as well. So a good way of speaking to families, talking them through the process and then sending the device on. So again, that's new work as well that we want to learn more about. Although installations were going on as normal for many, there was still a backlog building up again because a lot of people didn't want services in their home unless it was entirely necessary. So again, a lot about dealing with the backlog, and interested to hear how you're managing that. There was one thing that we kind of, for us, came into the stop category, and that's a couple of services described suspending getting paperwork signed, which is obviously something not ideal that you wouldn't want to carry on into the future, and I'll come back to that shortly. Moving on to maintenance, 22 services described changes in the way that they carried out their maintenance. 11 only did urgent and essential. 2 described carrying on as usual, but again, it might actually be the service user and their family who didn't want the visit rather than the service saying they weren't doing it as well. A bit more learning here. 6 services described increasing their testing or encouraging clients to test their alarms regularly. Obviously because there weren't maintenance visits going on, and Western Bartonshire gave a great description of all the different people they involved and services they involved in encouraging clients to test their alarms as well, and that actually did result in a huge increase in people conducting self-testing. Just another mention there for South Lanarkshire, who, you know, again, just simple things, but planning ahead, making sure when they did go out for maintenance that they had replacement equipment in the van, again to prevent that, you know, subsequent visits. And a good one here from East Ayrshire, as I say, this is a kind of look into the future, and when we're digital, they were finding that because they are using digital units, they were able to monitor connectivity and line failures from their portal. So they found a number of occasions where they could fix without a visit. They could carry out the fix remotely, or they could get the service user to reset the device as well. So again, looking at the benefits of digital telecare there. In terms of nationally, what we're taking forwards in this regard, really keen, Alison and Mary, to capture the work you've been doing in remote working so others can hear more about it and how you found that. Again, we'll approach East Ayrshire and hopefully look at the possibilities of sharing the resources about digital that they've developed. And I think because self-installation is quite a new thing, we would like to do a bit of work on that nationally, really to understand the benefits and the practicalities, but also the risks, and get the experience of clients in that as well. So anything you've done around that would be very interested to hear more about. I mentioned the stopping signing paperwork. Just to say, Argyll and Bute, Debbie Holroyd's done a lot of work in this area with colleagues in Argyll and Bute, and I've spoken to Debbie and she's happy to share her virtual work signing protocol that's been developed. So we'll link in with Debbie and make sure we can share that with you all as well. Moving on to review, I think 12 services carried on reviewing, but they switched to telephone reviews. And I think generally people found a good time to do reviews because it's an opportunity to test alarms, obviously, and to update information, particularly for the more vulnerable people. Aberdeen City described using the reviews to identify people who actually needed a more in-depth reassessment as well. And all sorts of services got involved in reviewing: call handling staff, Telecare staff who were working from home, and social work staff, all involved in carrying out reviews. And as I say, because they were quicker, because they were by telephone, it was an opportunity to catch up on outstanding reviews as well. And really, if there's any high-risk people who were needing a review, this was the opportunity to do it. Again, there were services who suspended annual reviews. And this comment from Falkirk, we can do parts of the review by telephone, but not all of it, I think is a very relevant comment, because obviously you can't do the equipment side of things so robustly, and also look at access and so forth. So again, there'll be some backlog here. Dorian and I had a chat about this and thought really actually this was an opportunity when you're working through the backlog to prepare for digital and also support asset management. So while you're doing those maintenance catch-ups, check the age of equipment, the peripherals in situ, who the telephony provider is, and the broadband provider. So if that sounds useful, I know Thomas, you're on the call, we could maybe have a chat about whether it would be useful to get a digital readiness checklist that could be incorporated when people are catching up on their reviews as well. And just to mention as well, a good practice guidance about review is on the tech work plan this year, so there's lots of learning for us there too. Moving on to call handling, I apologise for the pace of all this, trying to fit as much in as I can. 65% of services said they'd introduced changes to call handling here as well. And here's just the themes that emerged. A lot more detail in the report. A range of social and physical distancing measures were described, including Falkirk dividing their their team between the ARC and the disaster recovery site. A number of measures to increase call handling capacity, so that's things like introducing flexible shifts, stopping all non-telecare activities for call handlers as well. A lot of services describe the introduction of COVID screening questions to inform responders if a response was needed, and 3 services describe putting in processes to identify alternative responders where possible. There's a lot of very positive feedback around enhanced communication between the ARC and the rest of the service and other services during COVID as well, again to build on as well. And a number of call handlers were undertaking welfare calls too. So, for example, North Lanarkshire, they were daily reviewing their call volume and identifying if any service users were using their alarm because their home care had been suspended during COVID, and that gave an opportunity for the alarm receiving centre to liaise with the care team to reinstate care where necessary. And again, thinking about digital, East Ayrshire redeployed some of their smart supports workers into the alarm receiving centre, and they found some unexpected benefits from this in relation to the GSM units. It kind of bridged a gap and allowed better communication and understanding between the services about how digital is taking shape as well. So a bit of learning there. 3 services described introducing remote working for call handlers. So Hanover Housing moved very early in early March to remote call handling for everyone. Beeld a wee bit later in April did so as well, and City of Edinburgh, we'll hear from Sylvia shortly about their experience there. I think there was also a number of partnerships. In fact, there were 6 partnerships who were keen to move to remote working, but for various reasons were unable to. 5 because their solution wouldn't enable them to, and this was a finding in the TSA's paper as well, where they found that 60% of services found it difficult to look at the alternative working models because they had old systems and older platforms as well. And I suppose that's just a reminder that as a number of you are working to upgrade your solutions in the preparation for the digital transition, just making sure that remote working capability is included in that upgrade. And because we think this is an area with real potential, there's going to be a funding call going out in the next couple of weeks, looking to support some partnerships who want to do further work on this. So please look out for that, an opportunity for tests of change. Another new area was outbound welfare calls, and we actually saw over half of partnerships of services moving to undertake outbound welfare calls during COVID as well. So a lot to say about this, and of course we've got the outbound calling report as well. 4 services described coordinating with other services, so good joint working to provide welfare calls. 2 services described doing calls for their customers, but also vulnerable groups as well. And a range of people were doing these calls, people working from home as well as Telecare staff and others. And there were 4 services that said they didn't introduce this because there were others doing this kind of work. And that box on the left there, this is some of the groups who were targeted, certainly initially with outbound calls, so people who were shielding or self-isolating, people who didn't receive any other services, people without a named contact, people who hadn't used their alarm for a while, and also people in rural areas as well. I know Sylvia is going to touch on this a bit later, so I won't say any more about Edinburgh, but I think generally the feeling was that the outbound calling was very well received. And it's something that nationally we're very keen to explore further, and it was actually a priority for this year. So again, to build on the learning, we're looking to work with up to 3 partnerships to test new proactive outbound calling models as part of their service. So this call again will be coming out in the next couple of weeks to see who's willing to work with us on this, and as part of that we'll form a peer support group so we can share learning with others who are interested in that. Response visits, 83% said they were doing things a bit differently. Again, a lot of discussion around PPE and the use of PPE and when it wasn't used. I think the thing about response visits is a lot of services are really quite stretched in terms of delivering a response already. So there was lots of things that came up in the survey that might be potential use when considering response services in the longer term. 5 services described training up others to get involved in services. South Lanarkshire talked about redirecting calls to care at home when it's for toileting. I know that's been an issue for some people as well. West Dunbartonshire pre-COVID introduced a new approach to coordinating response visits with scheduled visits as well. Edinburgh, they increased, and I know Sylvia will talk about this, family played a bigger role, but I think the really important thing about that is that the Telecare service supported families to do that, and I'm sure we'll hear about that. And a number of services moved to a 2-person visit, a 1-person visit rather than 2. So what we're planning to release in the autumn is guidance on developing a business case for response service. I know a number of you were involved in developing that. We're finally going to get it out to you. But I think what we're hearing described here is almost a tiered model of response. There's a lot of learning here that might influence that. Here's my final slide, nearly there, and finally on to working with other organisations, which for me is a really important one. I thought this was really interesting and really encouraging, and lots to take from this. 68% of services said they were working differently and more with other services and organisations. They were making new connections to provide the right support for vulnerable people, and those needs tended to be identified during outbound calls. Other teams were getting involved in telecare delivery, installation and response, recognising the importance of telecall and telecare, increasing awareness and the value of telecare as well. But also telecare services were taking on additional tasks to support others. East Ayrshire were supporting care homes, and 3 services described working more closely with hospitals as well. A couple of quotes there to me are kind of say a lot, and there's the quote from Claxon Sterling. It's been amazing how everyone's pulled together, and I think there's real opportunities to improve the way we work together and integrate our approach as well. And Falkirk there described being included and round the table in a mini COBRA, kind of multi-agency group. So again, in the chat box, if anybody else has been involved in those kind of forums, then please let us know. I think it's really positive that Telecare were included in that. And the final comment I just want to make is that the survey showed that links with housing have improved, and joint working with housing has improved or changed within COVID as well. Working with sheltered housing for response, working as I mentioned before about complex installations. Edinburgh. Working again around sheltered housing support, and Argyll and Bute providing key safes for void properties as well. So I just wanted to mention at this point that we've got Geraldine Begg on the call. I don't know if you want to say a couple of words, Geraldine, but I think you're encouraged by this, what the survey was telling us, and wanted to support that joint working as much as possible.
Absolutely, Anne. Thanks for that. Yeah, so part of the programme is really seeing how I can support folk to link stronger with housing associations in their areas. Are people getting feedback from me? Sorry.
I'm not. I think it must just be your end, I'm afraid. Sorry, Geraldine.
So this is...
Geraldine.
Pardon, Doreen?
I'm just saying I was getting like a lot of feedback when you're speaking.
Oh, are you? Right, okay. This way instead. Hopefully that's a bit better.
That is, yeah, thanks.
Great, okay. So thanks very much, Anne. I really want to put a call out to all of you tech leads out there and just see who's up for working with me, because what I'd like to do is look at the housing associations in your area and the local authority. So we're not just talking sheltered housing here, we're talking about all those opportunities that housing associations have to be in touch with people who could potentially be benefiting from Telecare, who aren't necessarily in a sheltered or extra care setting. So if you put your names into the chat box, I can get in touch with you afterwards, and we can see how we can promote understanding and awareness and about your referral processes as well. So yeah, thanks very much, Anne.
Yeah, thanks, Geraldine. That's me just about.
And you're on mute.
Oh dear, classic mistake. Sorry, I was chatting away about my slides. My slides seem to have frozen. That's all I'm going to say, folks. I don't know if there's, Doreen, if there's many comments in the chat box, but happy to pursue those out of the call. And if it would be useful to have another session going through some of this, then we can obviously do that as well. We'll send out the report and it'll be available as soon as it's ready to go. And not too late to add a few additional contributions or comments if you would like to there as well. And I think with that, I'm going to stop sharing my screen. I'm going to hand over to Doreen. Thanks for listening, folks.
Thanks for that, Anne. Just like we were discussing this, and I think just reflecting on some of the findings, I think it was amazing the way that partnerships coped with the whole kind of rapid pace of change, and they've managed to change and redesign a lot of their services while still delivering them within a COVID crisis, completely unknown. You know, so like that was really good. And I think for me, some of the kind of highlights was about like the plans to deliver like self installs. So again, huge shift from like the kind of pre-COVID working. And I think there's like 13, so nearly half the partnerships thinking about doing that. And touched on the outbound and the proactive calls. And I think like prior to COVID, Anne and I had spoke to the partnerships about, you know, introducing proactive calls. It was something that they would be interested in doing because, as Anne said, it'd been identified as one of the priority areas for 2021. But most of the partnerships said no, couldn't do that. Possibility at that time wasn't right. However, as Anne has said as part of her presentation, nearly half, again 15 partnerships, are either providing this or planning to. So again, a huge shift in a really short space of time. I think the response service, the way that services tailored that around their service users, family and workforce. And I think one of the key things was the different relationships that that we built up, well, not we, partnerships built up with people out with their organisation, but within their organisation as well, and being included. Let's say the Falkirk one and the kind of mini Cobra was, I think, absolutely brilliant. So I think like Telecare has, it's definitely come on a lot of people's radar that wasn't there before. So thanks very much for all your really hard work. So I'm just going to hand over to Sylvia and Andy from Edinburgh.
Okay, thank you very much, guys. So my name is Sylvia Latona, and I've brought with me today, thankfully, two of my colleagues, Nikki Scally, who's our team leader who manages our sheltered housing project, and Andy Jones, who is the service manager and has the majority of the operational oversight for the Telecare call monitoring and response service. So I'm very glad to have them with us. Not especially because I actually was very new to ATEC 24 and the services provided by them, having only joined them about 2 or 3 weeks before lockdown started. So as very much the newbie, I was very happy to be able to work with a kind of senior team who were very knowledgeable and able in managing the services. So I just kind of really wanted to kind of share that with you today, because Andy and Nikki will kind of take you through the majority of the presentation. I just wanted to kind of introduce the service and some of the things that we did, and I thought it would probably be helpful to just describe that ATEC24 is really an umbrella organisation for a number of services, which includes the Telecare service, includes our sheltered housing, support worker service, and the community commitment service, and some small community assessment equipment assessment workers. So that is our kind of umbrella organisation. I'm just going to try and share my presentation now with you all. I'll go away. Here we go. Tell me, somebody, if this is working.
That's you, Sylvia.
Perfect, perfect. So I'm actually just going to hand over to Andy and Nikki to kind of set the context of our kind of COVID response, really, within the service area, and some of the kind of activities that we did to kind of manage some of the challenges and the opportunities that we've kind of taken from it. So I'm at this point going to hand over, and I'm going to shut up to let the manager speak.
Thanks, Sylvia. It's Andy here. Can everyone hear me?
Yeah, Andy.
Yes, yep.
Yes.
That's great. Thank you very much for inviting us today. Nikki and I are delighted to be able to go through some of our experiences, and I'm sure everyone around the table here there'll be so many common experiences shared, and it's amazing that we've actually managed to get through fairly unscathed, and I think everyone would feel there's a kind of sigh of relief there. But it's also been in many ways, it's been a very exciting experience, trying to work differently, trying to think on our feet, but keep everything under control. So I think when we first started with the pandemic, I'm taking a date from around about the 23rd of March. It was very important that we took a moment to just consider the situation that we were faced with. Obviously, it was a national picture that was developing, a global picture, and each of our services were all having to take a view on how best to move forward. For our own service, we have around about, just an overview, we have around about 9,500 Telecare users. As you can see from those bullet points there, we've got quite an establishment of sheltered housing tenants. We also have a number of housing associations, probably around about 300 service users there. Now we're a very busy service, as probably you would gather. We would average around about 35,000 calls a month. Actually, pre-COVID, I've done a few checks that pre-COVID we would probably take on average slightly higher than that. And also with the emergency monthly response visits, it's normally slightly higher than that, but through COVID, since March to present date, it's averaging around about 600 visits per month. So it is very busy. That equates to around about 22 visits a day, but pre-COVID, we were probably higher than that on average. Our establishment is 38 M&R staff. They're at the very front line. Those staff will be responsible for taking calls, but also responding. They obviously work to a 24-hour shift, early back and night shift. We were seriously depleted as the first few days and weeks progressed. We had a number of staff who were having to self-isolate. I should say, and I know everyone will share this view, I do think it was a really challenging time with this. We had this global situation, we had this health emergency, which was affecting everybody. But a lot of the work that we've had to carry out is on a very personal level with our staff group and with our partners and obviously with our citizens. So it really drilled down to some very, very sensitive conversations and decision making. And I'm sure you've all shared those as well. So thanks for moving that on, Sylvia. Lockdown priorities for us have been obviously to continue to deliver the service as well as we possibly could in this circumstances. And I should say, one of the things that we did from the very beginning was to set up a daily COVID meeting, and I'm sure you've all done the same. And that to me, and that is only recently in the last few weeks, we've made the decision just to pare that back. But up till recently, it met every day, every Monday to Friday for an hour in the morning, sometimes for longer. And it was the forum through which we considered all the issues of the previous day, the previous week, and planning for the upcoming immediate period, but also longer term. And in those meetings, we were pulling in so many of our colleagues and partners. The City of Edinburgh also had a command team. So a command team was very quickly established. So Health and Social Partnership allowed us, I think it was Sylvia who had the role of making sure there was a clear line of communication from the command team from Health and Social Care, and a lot of the Health Protection Scotland information was fed back through that mechanism. So just looking at some of the lockdown, could you go to the lockdown challenges, sorry. So some of the lockdown challenges that we faced were obviously the staffing. Staffing was a major challenge to us, and I'm sure you've all shared that experience. And again, it comes down to a very personal level conversation. Some staff were very, very resilient, but we had to be very mindful and sensitive that this was a very serious health pandemic, and we have a frontline team who go right into the community, and these aren't sterile environments. We are asking our staff to enter into properties that don't have that kind of the level of control that perhaps more established like hospitals would have. So we were very, very careful with our conversation with the staff group. And I think we were very good to overcome some of the fears. The fears were always there, but I think on the whole, and I think it's to our credit as a management team, but obviously to the workforce, that we've managed to progress right through, and there's been generally a feeling that the staff group, the service is very well supported. So communications have been really important. And I think very early on, we set out some very clear channels. We have, interestingly, just as lockdown hit, we as a service were still very much in transformation. We still are, but we had a very new staff group. We've recruited throughout the last year and a half, and we have a very new staff group. And it was really important that the training, we managed to keep training going as best we could, but there was an enormous amount of effort put on close supervision with our colleagues in the field. Accommodation, I think, again, this is a common a theme with everybody, is how best to make use of the accommodation available to you. So not only was there a challenge with physical distancing, but we also had opportunities, because we are quite lucky in that our very close working with sheltered housing, we knew there was access to other facilities around Edinburgh that we could make use of, community rooms and community offices. And they've been very useful to us over the last few months in terms of planning for how our staff can continue to engage with the service, but also deliver a modicum of distancing. ICT has always been a problem with Edinburgh. We've always been pushing for, perhaps part of our transformation would be looking at mobile remote working opportunities. As lockdown hit us, we were still existing with fixed workstations largely. Most of our management team have laptops which allow them to work remotely, but many of our frontline business support were having to kind of work slightly creatively initially in the accommodation that we have to try and keep distancing. But very quickly through the COVID meetings, we developed home working support, and we were able to, Sylvia was fundamental in securing a great many more laptops from staff around the council who perhaps weren't needing them as much as we did. So we were able to start to bring that through to the staff group to enable greater home working. And bear in mind, and I think everyone again will share this experiences, we haven't done this before. And it was amazing to me just how receptive everybody was to working differently. We've all been through change programs, and there is resistance, there's fear, but in this, as this lockdown hit us and the pandemic was very real, I think pretty much everybody took the change on the chin and got on with it, and actually learned a lot from it as well. I think we'll be taking a lot of those forward with us. So could we move on, Sylvia, please? So we did develop a lockdown plan. So as I mentioned, there have been these really pivotal COVID meetings, which has been the conduit through which we've moved forward on every aspect of service delivery, and as we've negotiated and navigated our way through this. We've taken the opportunity. One of the things in the early days that struck us was, what if we carried out some scenario thinking? What if the infection came into the workplace? And I think that was kind of one of the things that drove us to very early on look to reduce numbers in the offices and get people working from home, but also to look at getting support from elsewhere. We knew we were having a depleted response team. We knew that we had a fairly new response team with reduced experience, and we needed to try and find support. And we looked across the city, and we're very fortunate. There are a great many colleagues, departments that were able to put their hands up and offer some support. Families have been amazing as well. We as was mentioned in some of the previous presentations, the contact with families to assist with response has been amazing. Very, very understanding. I think at the height of Jontech, at the height of the pandemic, we probably had asked around about 100 families to help us, which is really quite significant. And the impact of that was quite significant too. Since that, we've obviously followed that up with, as mentioned in a previous presentation there, that we did some really good work with contacting families with help, advice, information, and also looking for feedback on how they felt we were performing, which was really important to us. And in fact, a lot of the feedback that came back went straight back to the frontline officers, and it was a real fillet to them. The quality of the questionnaire and the content was fantastic as a very uplifting experience for the staff to know that the families were really appreciative of what we were doing, and that they were very willing to muck in. And we decided to offer them PPE as well, which was very well and warmly received. And it was a not a great deal, but it was we felt it was a wee gift to them for being so helpful. Okay, could we move on? So we developed the responder service plan, and some of the bubbles there on the slide are quotes from some of the feedback. What we've been unable to do at the moment is to provide you with as much statistical analysis of our journey so far, but that's something that we'll be looking at. So this is very much a presentation today, just a kind of an overview and a sense of the kind of the broad challenges that we've faced. Yeah, with this slide, thank you very much, Sylvia. I'm going to pass over to my colleague, Nikki, give you a break from me for a bit. But Nikki has been an absolute soldier. She has been amazing. Nikki has come from a sheltered housing, very much like Sylvia. She's not actually been that close to Telecare response and monitoring previous to this event. Nikki's very knowledgeable, but she's been an absolutely amazing colleague to have working alongside us, and she has delivered on so many projects and products out of that. I'm going to pass over to her now.
Oh, thank you for the nice words, Andy. Much appreciated. Hi everybody, and thanks for being invited along to this. Initially, just prior to lockdown, when we had started as a management team to gather, and we were critically analysing the processes, procedures that we had in place beforehand to be trying to be one step ahead. We knew it was going to be coming in where the physical distancing, certainly around initially the sheltered housing tenants where a visit and support service had taken place. We knew this was going to stop, so we had to coordinate what are we going to do, what is the main areas of concern as we go forward. So, as I say, the week before we started contacting everybody within sheltered housing, we identified citizens who had access to family carers, other networks, and we made sure that these citizens had access to communications to contact us should this situation change. For the more vulnerable without access to support, we coordinated that this support will still be taking place. That then progressed to the citizens within the ATEC overall who had the alarm equipment to focus on. It was huge numbers. So this is then when the wellbeing activity calls was going to be taking place throughout. And within the period of lockdown, there was over 21,000 wellbeing calls to our citizens who have our equipment. Within this period of time, there was over 1,100 non-essential visits that took place. Now, that would be analysed on a weekly basis for the need. Some of these citizens we had contacted at the beginning, they had networks, they had family support, neighbours, friends, but as we progressed through the COVID, some of these networks broke down, and we were then having to step up, support people to make sure that they remained well. We provided through the contact various pieces of information regarding keeping fit and active, healthy. The general mental health wellbeing we noticed had a huge impact on a lot of the citizens. There was at that time a lot of calls that was coming into the receiving centre, over 200,000 incoming alarm calls. Not all of them actually needed any kind of responses, but it generated lots of calls at a time where the office, we were trying to minimise the staff in the office, also the difficulties that we had sometimes with shifts and accessing reasonable numbers of staff for these coming in. But there was a huge, over 3,700 emergency responses that came in that did require visits. But what I have to say is that yes, initially it was quite a frightening time. What are we going to do? How are we going to cope? The staff numbers are going to reduce. We may have vulnerable people that will slip through the net. The wellbeing calls was great. The feedback that we've had for citizens during that time was that they've really appreciated it. It's gave us an opportunity to reflect on how we carried out tasks pre-COVID, whereby we carried out visits to citizens to check their well-being. And as you can imagine, some of these visits, it's not to actually provide a specific task, it's to ensure that the person is well, that they're coping well. And there had been discussions previously about, can you gather the same information? Can you build the same relationships up with a telephone call? And what we found through COVID and being put into this situation is that our relationships has improved. The citizens' opinions of the service has increased. It's improved. They look forward to the telephone calls. And there's not so much of an invasion of privacy where you're going and visiting people that doesn't have a support need. So that's one of the major positives that we will take forward. I think one of the other difficulties during the wellbeing calls initially was principles of confidentiality. You're making wellbeing calls to people at a time in society where we know that there's a lot of scam calls, and so there was a lot of citizens initially who was quite reluctant to engage on the telephone conversations, but we would provide alternative numbers. We would share a piece of information so that they could then confirm we were genuine. And from there, the responses has been that they thoroughly look forward to getting this wellbeing call, and they now feel more confident in contacting the service when they've got a support need, to look for advice if they're deteriorating health before it gets to crisis stage, because we have now provided them with wellbeing advice, staying fit and active, falls prevention, access to other pieces of technology and equipment, and it certainly has, from our point of view, helped to build better relationships with the citizens we previously only had contact with during emergencies.
Yeah, the interesting.
Sorry, can I just, I'm just going to come in to this slide here just to say that some of our team also were quite pivotal in the shielding work that was going on. So some of our team were making those shielding calls, as well as the teams, part of our team that were making the wellbeing calls. That was kind of how we used our home workers primarily. And unfortunately, one of our service managers led the shielding work, and he can't be with us today, but I just thought I'd put up, this is some of the kind of impact that some of that work had on people with dementia. I'm really going to kind of move on to continue with really primarily the material we want to share with you today. Sorry, Andy.
Yeah, thanks, Sylvia. And again, Nikki's probably far too modest, but those 21,000 calls to citizens over the last 3 or 4 months had to be done with a group of home working staff who are scattered around the Lothians, even further afield. It was a case of getting work instructions out to those individuals, getting them access to job tech or a laptop, and holding 20, 30 calls a day, collecting the data, bringing them back into the main office, where that data is then processed and updated onto the system. So it was quite a logistical task involving a cast of I don't know, 20 or 30 people. So it was a really good piece of work, and it's something that we do want to continue in terms of engaging with the citizen, which is that first bullet point there on the slide. So we are keen. I mean, actually, well before COVID hit us, Sylvia and the senior management and the operations management were having conversations about how we can move forward with new ways of working, new thinking. And I think one of those topics, recurring topic, was prevention. And one of the mechanisms towards prevention is greater connectivity with the citizen. So the work that Nikki's done and the team has probably brought that to reality much quicker than we'd have anticipated, and the hope is that we will move that forward very quickly. So in terms of the proactive service opportunities, so some of the points there, falls pathway, so which I've just touched on there. I think many services offer the fallen uninjured patient product, and we do that very well. We're very established at that. That's probably the route by which we will start to move towards prevention work. And I know Sylvia is very active in at the moment investigating how we can start to pull all the pieces together to make that happen. Keys and key safes. So obviously we are probably outmoded in some respects in the way that we continue to hold individual keys for many citizens, but we are starting now to seriously reduce those and insist that citizens now, if they require a service, part of the deal is that they take a key safe, and that's moving forward as we speak. So that will have an impact, and obviously moving to key safes, as we know, is much better for response. Shared skills and experience, workforce agility, mutual support. Throughout COVID, it's been absolutely astonishing. We've had support from the 4 or 5 locality officers, individuals joining us on response without very much training. They're knowledgeable and professional in their field, whether it's OTs or CCAs. They've been absolutely fantastic in helping us in a planned way. They've offered access to their staff, which has been very useful for sharing knowledge. Again, we've had an amazing relationship throughout COVID with the Smart Centre at Ashley Ainsley. Their driving assessors have stood down. There have been no driving assessments over the last few months, and they've been able to offer us a full team for many of the shifts throughout COVID, and that has been probably some of these additional supports of probably what's kept us afloat in many ways, because even today we are still low on numbers on our own staff. So although these services have started to revert back to their normal working, we are extremely grateful for the impact that they've had. Digital opportunities. So we're on the digital journey, as most of you will know, but it can't come too soon in many respects. And I think this whole experience has probably reinforced the view that the opportunity to go digital and the flexibility that can offer us will help future issues of the same kind of incidents. Continuing positive changes. So we're looking at continuing with the engagement with partnerships, internal partnerships. Wellbeing calls, as we've touched on in some detail earlier with Nikki, that's something that we will continue to bring into an element of our normal working. We want to really develop that side of our operation. Community collaboration. So this is very much the 3 conversations that we're working through. 3 conversations is looking at developing products out of very quick ideas generated across across all stakeholders, and to see if we can make improvements very quickly. Key safes we've mentioned, and making better use of the accommodation, including community rooms, which we'd mentioned earlier. But what we're very keen on is what this has demonstrated is the positive impact of enabling staff to work remotely, and there is no deterioration in service if you get everything in place. And I think we've all learned that there's a benefit there. Do you want to have a just look at those? I don't know if you want to add anything to some of the these last slides, Sylvia, but I'll just keep going otherwise.
Yeah, I'm happy for you to keep going, Andy. Yep.
So what needs to stop? So the locality assistants they're returning back to normal duties. So we have very little opportunities right now. I mean, what I think we're all aware of is that this is not going to end anytime soon, and at any moment in the next few weeks we could see an escalation. So all these relationships that we've developed, nothing closes down. We will keep those links, and if we need to, then we can easily re-establish them. Some workers returning to frontline positions. So a number of our staff may actually, particularly as the pandemic is still there, it's still a risk. Some of our frontline workers may not return to some of the coal-face positions, in which case we will be working with them to look at how we can utilise them in other important elements of the operation. Strict criteria application. So this is about, we need to perhaps think about loosening some of our constraints on where we can apply our skills and expertise, see if we can expand those. And I think we're looking at probably a more multifaceted, more integrated way of working with everybody through health and social care. And on changes of well-being. So I think that will become an integral part of our everyday function. Services on hold. So direct face-to-face services other than equipment provision and responses to alarm activations, group work activity. We still have very significant controls around the building, and also controls on the customer-facing elements of our operation. So they will still be in place, along with and we'll always be monitoring Health Protection Scotland guidelines. Collections of alarms is a very interesting development, where we have staff who have been isolating, returning to us, but not returning directly to the front line, but still offering a lot of value by undertaking, in this case, alarm uplifts and equipment uplifts, but in a very controlled manner, which does not expose them or the citizen, or indeed ATEC 24 staff to too much contact. So that's been really useful. Future developments. So I think out of this, you can probably sense that there's so much that we want, that we're looking forward to developing. I think it's brought into focus a lot of things that we know that we can run with and develop and improve. I think it allows us to think differently. I think there's an appetite amongst the whole workforce to see things slightly differently now, and to look at ways to offer enhanced services, but operating in a slightly different way. I think, although, just to kind of summarise from my point of view on the presentation, I know Sylvia will close it out with a few comments, but as I said, I think we've all found it very challenging. Sometimes it's been seat of the pants, but I think out of it, there is so much positive work that we can move forward with. And I think we've probably had a workforce on the front line, particularly, who can see that there are probably ways that we can move which will help them in fulfilling their duties more effectively too.
Thanks, Andy and Nikki, just for taking that through. I'm going to come out of this if I can. That does. Sorry. So yeah, I just wanted to say I think that our experience through COVID has been just a massive learning experience, but one where we've seen so much opportunity as we have kind of learned as we've gone along, we've adapted things as we've gone along, and there are definitely things that we want to take forward. The well-being work, we certainly want to expand as part of our review programme, but also as part of a kind of preventative and prevention approach, as Andy has kind of mentioned there. Obviously our digital and remote working, agility, bringing more agility into the service, we want to increase as well. And yeah, it has been a really positive experience with so much learning. I think we will want to kind of write it up in probably a fuller way than we've been able to kind of share with you in person today, because there's been so many strands to it that it's been difficult to kind of cover it all. And I apologise for going a bit over time. We've taken up quite a lot of your time, but thank you.
Thank you so much, Sylvia, Andy and Nikki, for a fantastic presentation. Just shows you how much change everybody's been through, and you know, it's a tremendous effort by everybody, and really needs to be acknowledged. So thank you for that. And then going back to that question I put up on the screen at the start of my presentation, whether there will be major changes in service development following COVID. It sounds to me like there certainly will be in Edinburgh. So really look forward to watching what happens next, and where this goes for you. Sorry to keep you all a wee bit late today. I'll just put this slide up again, because we've got there's another drop-in session next week, and it's digital telecare. I think Laura's going to put a link in the chat box for you to sign up for that if you'd like to. But just again, say thank you very much for everybody for joining, and thank you very much to Andy, Nikki and Sylvia for a great presentation. And all the slides and the recording will be available if you'd like to look back in it. So thank you all, and enjoy the rest of your day.
Thanks.